Hello, my name is Michelle Kondo, and I am a research social scientist with the USDA Forest Service. I'm here to talk with you today about some recent research around the association between community greening efforts, fear of crime or perceived safety, and mental health. First, I'll describe a study led by the Michigan Youth Violence Prevention Center as part of their uh, project funded by the Centers for Disease Control here about community greening interventions in Flint, Michigan, Youngstown, Ohio, and Camden, New Jersey, sort of mid-sized cities. The research I describe here today focuses just on work conducted in Flint, Michigan, and it was led by Cassidy Burt, who is a doctoral candidate, an excellent one, I might add, at the University of Connecticut. This work relates to post-industrial landscapes or cities that have been left with an oversupply of vacant and unmaintained space. We test the busy streets theory with this research, which holds that engaging residents in improving physical spaces or neighborhoods supports positive social interactions. It can reduce fear, crime and violence, and it can improve social resources and community well-being. So while recent evidence has found that similar community greening efforts can decrease depression or improve mental health for nearby residents, we don't necessarily know the mechanisms. In this study, we ask whether perceived safety or fear of crime is the route by which neighborhood greening might improve residents' mental health. So between 2016 and 2018, this project helped fund community greening, both professional mowing and youth engaged greening at about 7,000 vacant lots throughout the city. So we collected social information via a survey, and we assessed parcel maintenance using an observation tool. And we assigned each study parcel to a street segment, which was our unit of analysis. And you can see here about how many study parcels and about how many survey responses were assigned to each street segment. So our hypothesis was that improved parcel maintenance or better parcel maintenance would be associated with lower fear of crime, which then in turn might predict lower mental distress and controlling for a suite of both individual level factors that might confound this feeling, might also predict mental distress, as well as area level sociodemographics and crime density. And so using longitudinal data, and structural equation models, indeed, we found that the greater values of parcel maintenance predicted lower fear of crime, which in turn predicted lower levels of mental distress. Again, this was all at the street segment level, controlling for a set of demographics variables. So we see here that the positive impact of land maintenance or greening on mental health may operate through reducing fear of crime. But can we assume that this mechanism holds for everyone? I've also been engaged in research that investigates whether this holds true for men versus women. And you can see, at the bottom of the screen, this is a study that we just recently published here a few weeks ago. So we based some analyses around an evaluation of the land care program's clean and green intervention in Philadelphia. We had survey data from 442 residents that lived either near an intervention clean and green parcel or near a control vacant parcel. And as you can see, there were nearly 600 vacant lots randomly assigned throughout the city as either an intervention or a control lot. And so we asked this question: do differences in feelings of safety during the day and after dark uh, between the intervention and control groups vary by gender? Um, and we were able to use survey questions that, from residents reporting whether or not they had stayed home or altered their ability to go out because they felt unsafe, either during the day or at night. And we found that men who lived near the clean and green lots felt significantly safer, but women did not. So at night, while our findings were not statistically significant, they were in quite an opposite direction, where men felt safer, but women felt less safe to go out after dark, after the intervention. We don't know the reason for these findings. Men may have changed their behavior, spending more time together outdoors in the clean and green vacant lots, and this is by intention. And perhaps we would see a benefit from this, right? Reduce social isolation, better social resources. So, but while young men, often lower their perceived risk of victimization by traveling in groups, this behavior can increase women's perceived risk. Um, and especially young women's. And this is a public health issue. Why does this matter? It's because increased fear can disproportionately affect women's health and well-being. Fear of crime can constrain women's mobility and their physical activity. Avoidance behaviors can increase isolation, right, and thereby impact mental health. So while we're often seeing a net beneficial association between green space exposure and mental health, the mechanisms and whether these benefits hold for subgroups is often left unexamined. And I am hopeful that further mixed methods research can explore this issue, especially for population subgroups and potential vulnerable populations, for whether green space exposure and interventions indeed improve feelings of safety and thereby mental health for everyone. Thank you very much.